We are back with more What's Now, and we are continuing our focus on your health. I spoke with the Budgetnista all about why it's important to prioritize making decisions about your health care, your insurance, and the policies. She tells us why you should do it right now. Don't delay. Here's more.
Hi, Christine.
Hi, how are you?
I'm well. How are you?
Doing good. It's open enrollment right now, which is the time to make the important decisions about your health insurance. However, a new workplace study from Aflac shows that many people, especially millennials, don't take the time to understand their plans until they are sick or facing critical issues. Joining us today is Tiffany Aliche, a financial educator and best-selling author known as the Budgetnista. Thanks for joining us.
Thank you for having me.
So how have you helped so many people get control of their finances, and especially in terms of their health insurance?
Well, Christine, I've been fortunate that I grew up in a household where money was talked about all the time. After college, I went on to become a school teacher for 10 years. So I married my love of personal finance and education, started a company that's helped nearly 1 million people get and stay on financial track, and your health insurance is part of that financial track.
So tell me why choosing the right health care plan is super important for your financial health.
Well, if you don't choose the right healthcare plan or don't choose a plan at all, it's going to affect your finances, because if something should happen to you, you might not have the coverage necessary to take care of that emergency. This is why I'm so excited about Aflac and their workforces report. They found that people actually aren't choosing. 93% are on autopilot. They're choosing the same plan year after year, and that's not good.
Yeah, exactly. That can be a problem. Tell me about some other highlights from the survey.
Some other highlights from the survey are that 6 out of 10 folks actually feel stressed in doing the research, so I can understand why they're avoiding doing so. So much so that over 50% spend less than 30 minutes on doing the research. People spend more time choosing a social media post, right? So the reason why that can be dangerous is that over half of those folks don't have more than $1,000 saved. So if you don't have enough savings and then you've chosen a plan that's not really in alignment with what you need, if you experience a medical emergency, you are going to experience a financial emergency as well.
So how else can we reduce or eliminate completely costly mistakes?
Do the research. It's perfect timing because it's open enrollment, so spending the time and the energy into doing the research, but not doing it alone. You don't have to go alone. As a matter of fact, if you're an employee, your HR department is there for you. You can reach out to them, go over some of the benefit packages that are available to you and ones that are going to be in alignment with who you are now, but also being mindful of your family's health history. So is there diabetes or maybe high blood pressure in your family's health? So you're wanting to know that, so that way when you're choosing a plan, you're choosing the right plan.
So tell me more about the importance of a complete benefits package.
So here's the thing that Aflac found is that employees are really wanting a complete benefits package. They're not just wanting health care benefits, they're wanting something called supplemental insurance. 85% of folks that were surveyed said that they'd be interested in this. And what supplemental insurance is, it does just that. It supplements insurance. It really plugs in the holes that are left from your health care package. And supplemental insurance can be things from like accidents, cancer, illness, and should those things arise and happen, you can get assistance and help with your groceries, your copay, even your rent.
Such good advice. Anything else that stood out from this survey and that we should do?
Yeah, so what stood out to me from the survey is that people do want insurance. I think because they're not doing the research, it would suggest that they don't want insurance. That's not true. 84% of folks want insurance, and especially insurance that's in alignment with their family's health history. Also, something kind of funny that stood out to me was that Generation Z and millennials are really opposed to doing the research, so much so that 1/4 said they'd rather give up their morning coffee, their caffeine in the morning, right, versus doing the research when it comes to health insurance.
Wow, that's pretty drastic, actually.
Yes.
Well, this is great information. Where can we find out more?
So you can learn more information. You can start to do that research at aflac.com. And to remember, Christine, that your health truly is your wealth.
Well, thank you so much, Tiffany, for giving us this great heads up to help our finances and our health insurance.
You're welcome.